Diabetes is associated with significant morbidity and mortality. The cardiologist primarily views diabetes as a comorbidity of heart failure, but perhaps the more accurate point of view would be to look at it the other way around. That's why a paper in one of the Lancet journals was recently entitled Heart Failure, a Cardiovascular Outcome in Diabetes That Can No Longer Be Ignored. So we're talking here about prognostic implications of type 2 diabetes in ischemic and non-ischemic heart failure. This is a paper from the September 27th issue of JACC. And to do so, I'm talking with first author Isabelle Johansson, who is an MD and a PhD fellow at Karolinska University Hospital in Stockholm, Sweden. First off, thank you and welcome back. It's nice to see you again. Now, you're using data from the Swedish Heart Failure Registry, and your main inclusion criteria, which I love, is clinician-judged heart failure. I mean, that's an all-comers trial if I've ever seen one. So let's talk about the registry first. What is Swedish HF?
So Swedish HF is first of one of the largest heart failure registries in the world. It's a national heart failure registry encompassing about 80% of the Swedish hospitals. So patients from cardiological units and medical units can be included to this registry, and also outpatient specialist care within cardiology can include patients to the heart failure registry. There is also a primary care arm with not as big of a coverage, but still growing as of right now. And I have been using data from 2011 for this particular study.
Well, what you're looking at is a number of patients. So how many did you actually have, and what did you find when you analyzed them?
So we have analyzed about 40,000 patients with and without ischemic heart failure, with and without diabetes. And we stratified them like that and looked into baseline characteristics, what were the differences to start with, and then also tried to compare the prognostics about how type 2 diabetes influences prognosis, basically when you have ischemic heart disease and when you don't have ischemic heart disease. And also what we did was to look into the prognostic implications of previous revascularization. From an observational point of view, of course.
Yeah, from the numbers, what are you seeing?
From this registry, we have about 25% with diabetes, so close to 9,000 patients. That is the ones with a pre-reported diabetes diagnosis, and we are, of course, suspecting that that is an underestimation of how many people actually do have diabetes, knowing what other studies have shown in cardiovascular disease populations.
So how did the risk change based on whether they had diabetes or not?
To start with, if you look at the patients with ischemic heart disease and type 2 diabetes, the risk, there is an increased risk of mortality of about 40%, increasing to 45% if you also did not have a previous revascularization, as compared with the ones without diabetes. And if you look at the ones without ischemic heart disease, they're having diabetes as compared to not having diabetes gives you about a 30% increase in mortality risk.
And the heart failure side was really, that was the bad combination, right? I mean, you had type 2 diabetes remaining always predictive of mortality even after rigorous adjusting. That's pretty impressive. And I think doesn't it mean that we really need to pay more attention?
It sure does, and I mean we have to think about this population as a contemporary, everyday life heart failure population, and that is what is so special about it. That we have a mean age of over 70 years old, 75 about, and I mean these patients are burdened with comorbidities and they never get included in the clinical trials. But here we have a large cohort where we can do fantastic statistical analysis, and I mean, we're not finding facts, but we are finding very interesting observations that needs to be taken seriously.
Now, the accompanying editorial comment is by Hauling et al., and it's entitled, "Diabetes and Heart Failure, Sugared Words Prove Bitter," an old Spanish proverb. And they wrote, diabetes is a very serious complication of heart failure, and potentially even more important, heart failure is a very serious complication of diabetes. A lot can be learned from registry data, but we should not forget we do still need some randomized controlled trials in order to really parse out all of this stuff, correct?
Absolutely. I couldn't agree more.
I mean, we really do need to think of it too as not just a comorbidity that's off in the background, that's somebody else's job, but it really is, it can drive, heart failure can drive diabetes, diabetes can drive heart failure. I mean, it's a real big mess. We had a cover of Cardiol Source World News recently where we talked about the three elephants in the waiting room. And one of those elephants was diabetes. So we're hoping that cardiologists will pay a little bit more attention to diabetes of their patient and maybe consider that in the way they're treating patients.
Absolutely, and not only search for diabetes, but also search for the pre-states of diabetes, because fact is, the prognosis is similar. It's more similar between the patients with diabetes and heart failure and pre-diabetes and heart failure as compared to the ones with a normal glycemia when it comes to prognosis. So we need to search for dysglycemia.
So you've got this great Swedish HF registry. Are you going to do anything else with it? Do you have any future plans? What are you going to study?
Yes, absolutely. We're looking at, there is a huge debate ongoing about HbA1c and pre-diabetes, diabetes, as I just mentioned, and we're looking into that. Of course, it's a heart failure registry, so there is quite a few missing data, but here at this Congress I had an abstract or a poster about HbA1c in this particular registry, and we find some interesting findings there as well.
What did you find?
We found that especially for patients with an unknown diabetes diagnosis, there is 15% with an HbA1c that would suggest that you actually have diabetes, and another 30% with pre-diabetes, and these patients have a worse prognosis, or this is associated with a worse prognosis compared to having a normal HbA1c. And we need to, cardiologists around the world need to search for dysglycemia basically and intervene while there's still time.
Well, on your search for information at least, please check out the September 27th issue of JACC and this particular paper on prognostic implications of type 2 diabetes and ischemic and non-ischemic heart failure. For Cardiol Source World News and Cardiol Source World News Interventions, I'm Executive Editor Rick McGuire.